So Ellen and I are going to describe some ankle flexibility and strengthening exercises. The first one is done easiest up against a wall. If you have a staircase, you can also use a stair. She's using a wedge on the floor. If you do not have something like this, you could use a few books. You could stack a few encyclopedias or a dictionary up against the wall to use that. What she's doing is keeping her heel down on the floor, which is the most important piece of it, and her back knee is straight. As she does this, she's stretching the back of the calf. She's going to again hold for 30 seconds, and she's going to repeat it 4 times. A good alternative to using the wedge is stepping onto the floor. She's going to put her left foot behind herself. She's keeping her heel down on the ground. She's keeping her knees straight. She's holding for 30 seconds to stretch her calf again. And again, she'll repeat 3 to 4 times. A second step in this exercise is to keep the heel down, but then to also bend the knee just slightly and sit her rear end back. This will transition the stretch a little bit further down in the calf muscle. Again, holding for 30 seconds and repeating 3 to 4 times. And then relax. One other stretch that can be done for your ankle is done in a kneeling position. So Ellen, why don't you come on over to the table. You're going to climb on to your hands and knees, keeping your toes pointed. You're just going to sit back onto your heels. What you're trying to do is keep your foot down in contact with the surface that you're on, whether it be your bed or your floor. You're holding for 30 seconds, and again, resting in between, but repeating 3 to 4 times. Okay? Next will be some ankle strengthening exercises. So I'm just going to have Ellen come into a long sitting position. I'm going to prop her foot up so that her foot and her heel have a little bit more freedom to move. You can use anything underneath. It can be a rolled up towel. It could be your bathrobe, whatever you'd like to use, just to get the heel up off the surface. There's many ways to do strengthening. An easier way is with a piece of elastic tubing. They're colored by gradient. So the lighter colors are the easier ones to use. The darker colors, the grays, the blacks, the blues, are a little bit harder to use. So I recommend starting with a light color. So Ellen is going to hold the band, and she's in charge of how much tension she applies to it, which will make the exercise harder and harder with the more tension that you apply. So what Ellen is going to do is just keep her heel free, and she's going to point down like she's on a gas pedal. She takes her foot through a full range of motion, and then she comes back slowly. She points, she'll pause for a second or two, and then back slowly. Don't just let the band pull your foot back quickly. You point and hold for a second or two, and then it comes back. Each one of these strengthening exercises, you'll want to perform 3 sets of 10 repetitions. The next strengthening exercise is you're going to incorporate your opposite foot to anchor the band. So what you'll do is just switch directions. You'll loop it around the bottom of your opposite uninvolved foot. This uninvolved foot will stay still, and now she'll pull her foot out towards her pinky toe. It's a very small range of motion, so don't be concerned if your foot doesn't go too far. Her knee is pointed straight up to the ceiling. Her leg itself is not moving. Everything is happening from the ankle down. She pulls out, holds for a second or two, and slowly comes back in. Okay, the next direction, she will incorporate her opposite foot again, but we're just going to move the band to the other side of her foot. We're going to ask her to cross her leg over, bringing her foot to this side. Yep. Again, using the uninvolved foot as an anchor for the band. She'll hold on, and the involved foot will move in towards the great toe. And it comes back out. Again, the leg of the involved side is not moving. It is just the foot and ankle moving on this side. She pauses for a second, and then she comes back. She'll pause for a second, and then comes back. And then the last direction with the band, you'll have to enlist some help. The band will get held at the bottom of the foot or underneath the foot. And then Ellen's just going to pull her foot straight back. Pause for a second and then come back down slow. She'll pull back, pause for a second, and then comes down slow. Go ahead for one more. And again, all 4 directions with this band will be done for 3 sets of 10. 1 to 2 times a day, depending on your symptoms. One more advanced exercise for the foot and ankle is your traditional calf raise. So I'm just going to have Ellen stand back up. You can use a wall or a staircase, a railing, your countertop for balance if you need some assistance. So I'll just have her use the wall for balance. As you do calf raises, you want to make sure that your knees stay straight. Our tendency is when we rise on our toes to bend our knees forward. You want to try to keep them as straight as you can by engaging your quad muscles and rising up as far as you can onto your toes. Once you get to the top of the movement, again, you hold for a second or 2, and then you lower down nice and slowly. These exercises also will be done for 3 sets of 10. We recommend starting with both feet at the same time. And as you progress and get stronger and stronger, you can move to single leg heel raises. Also for 3 sets of 10. Please keep in mind that if any of these exercises cause any pain, discontinue until you talk to your practitioner.